Welcome back to the Per Report. After years of lobbying by pediatricians, Hong Kong is slated to get its first children's hospital in 4 years' time to treat kids riddled with severe illnesses. Tonight, we follow the journey of a boy battling a rare condition and see how children in the same boat might benefit from centralised specialist care.
有冇話啲乜嘢嘢，譬如肌肉痛啊嗰啲唔舒服？平時返學啊、活動啊嗰啲有冇問題啊？ 冇問題啊，
Tang Zikit is recovering from a debilitating disease affecting only about 3 in 1 million kids a year. He's been in and out of hospital, treated by rheumatologists, neurologists, radiologists, physiotherapists. Zikit was a very active 13-year-old back in 2010.
My arm started hurting really strangely. Even if you would touch it lightly, it would sting quite a lot. And the other time was when I fell over during a basketball match. When I started feeling extremely tired, I had to find help.
He ended up at Prince of Wales Hospital's pediatrics ward. His muscles were losing strength and aching. He had rashes.
His clinical conditions is very compatible with juvenile dermatomyositis.
Juvenile dermatomyositis causes muscles to inflame and weaken. Pediatrician Asunta Ho has trained in rheumatology.
We have to consider other rare muscle conditions that we rheumatologists would not be very familiar with.
So pediatric neurologist Dr. Eva Fong was consulted.
Muscle weakness is a very non-specific symptom because neuromuscular problems may present a weakness. So I helped him to do the nerve conduction study to confirm the nerve functioning normally. 有冇感覺？大少少，好痛啊？ Okay. His response is normal. Few years back, when he at the diagnosis, his nerve conduction is also completely normal.
You can see the
faulty nerve conduction ruled out. Zikit was referred to a radiologist.
He was profoundly weak in all of his 4 limbs.
Professor Griffith is a specialist in bone and joint scans. He used magnetic resonance imaging on Zikit.
MRI is by far the most sensitive method for looking at muscle abnormality. The joints were normal, but practically all of his muscle throughout his body was severely inflamed.
After gathering all the investigation results, we were confident that Zikit actually suffered from juvenile dermatomyositis.
We were heartbroken and very sad. The cause of the disease is unknown, so we were so worried all the time, hoping to see how the doctors could help.
Dr. Ho prescribed immunosuppressants and steroids to tame Zikit's muscle inflammation.
He didn't respond to our treatment. Instead, his condition deteriorated over the time. When he first came into our ward, he was weak, but he still managed to ambulate on his own.
About 2 weeks after Zikit started on the mats, he became bedridden for 3 weeks at one point.
I couldn't move. My parents would have to help me lift my leg 1 step at a time, and it would basically be like this before I had to move up once. It would take up till half an hour or an hour just to get up this flight of stairs. I could fall at any time if I was too tired.
Zikit almost needed round-the-clock care. Turn on his side, get out of bed, go to the toilet, drink water. He needed help. So we had to put our worries aside and devote our care to him.
They were actually more worried than I was, way more worried. I had to return more emotional support, so that was one of the funny things.
We usually ask the patients to perform different maneuvers.
In a childhood myositis assessment, Zikit, at his worst, scored only 2 out of 52.
It's necessary to take some tissue from the muscle for further analysis.
By way of a needle biopsy.
There was lots of inflammation in the muscles. It demonstrated the disease was very aggressive at the moment. That's why we added in 2 further immunosuppressants.
despite rife side effects.
We still have to control the inflammation, otherwise he will suffer from major damages.
Myositis can definitely affect other systems like the swallowing and breathing, the heart rhythm as well.
Due to weakened muscles,
I had to eat either quite liquidy food or mashed up ones, because if you had anything that was a large piece, there would be a risk of choking. And I tried that once and it wasn't a good experience.
We really need to prevent potentially life-threatening complications.
nevertheless,
Then Zigit became less grumpy, his general condition was better.
and he could return to school. That was 5 months after the initial diagnosis in early 2011.
He was still very weak. He had to use a wheelchair, which he wasn't very happy about.
I went back to school then, and they had to take class photos. I could only stand 1 or 2 minutes without support. Longer than that, I would probably have to lean on something, and even longer, I would have to just return and sit down onto the wheelchair.
Zigit's parents wanted him to drop school for a year to focus on recovering.
But then I saw that as a sign of weakness more than anything else. I just did the work at my own pace. I was quite anxious to get better because I wanted to play basketball again. Sometimes when you look at people play and you can just sit there, you get quite jealous.
But he remained very weak, so doctors decided to extract a much bigger chunk of muscle from Zigit's lab for testing.
This time, the result was very reassuring. Inflammation was actually much reduced. We didn't see major muscle damages. We were confident that with time and with training, Zigit should further recover.
In late 2012, Zigit began strenuous physiotherapy.
At the very initial stage, he can't even have his head lifting up.
Zigit consistently uses his legs to exert force to maintain these exercises' velocity, not relying on the machine.
The exercises before have been simply stretching or moving my legs, to now where I can ride a bike or use different machines. There's definite improvement there.
呢個運動咧就係練下呢個重心轉移啦，同埋練翻啲肌力同埋肌嘅耐力嘅，你就可以之後咧就可以咧去做啲單腳企啊同單腳跳咧都有啲幫助。
Zigit had another CMAS test.
有張凳喺隔離嘅，咁我想你慢慢起身。如果有需要就扶住張凳，冇需要就自己起。係喎，幾好喎 ，OK 喎，係咪啊？個姿勢嗰啲都 OK。我哋做即係咬手瓜，好，準備1、2、3。OK， 好啊，調翻轉拱出嚟啊，係非常好。好 ，Is much better. And the score was 51 out of 52.
1 point deducted for weak thigh muscles.
For the case of Zigit, his disease is rare, so it's better to be managed by a team of staff.
Especially if the patient is not responding as good as we expect. We need to know our limitation and when to call for help.
With the centralization of the expertise in the future children's hospital, we hope that we could provide a better care for patients with rare disease like this.
It's a children's hospital. They wouldn't have to mix it in with adults' cases or the elderly cases. Diagnostics would be faster, treatment would be faster.
Currently, 13 public hospitals and all private hospitals provide pediatric services. From 2018, the Hong Kong Children's Hospital in the Kai Tak development area will start concentrating on kids with cancer as well as cardiac and kidney diseases. In the second phase, multidisciplinary teams will tackle complex and rare conditions like Zigit's.
All these cases under one roof, then the doctors will have the much better exposure to all different kinds of diseases.
Zigit is Alan Fu's first juvenile dermatomyositis patient.
We need to have a deep investigation for what is appropriate for Zigit for training. Hospital, which is truly for children, can keep on learning from case by case. I have learned a lot from him also.
I used to view the world in a slightly more negative way, but after the illness, I could see people were willing to help.
Zigit, now 17, has passed his GCSE with great results, even as he continued treatment in hospital every day.
His condition is still active, but then we managed to suppress the inflammation by ongoing use of the immunosuppressant.
Different specialists all gather together and do their part. That was the largest part of inspiration, to be able to help others in an optimistic way.
If there's a hospital pooling so many specialists, I'm happy for the kids. I don't want to see them suffer.
People like me with a severe case, they would actually have a better hope for recovery.
Well, thank you for watching our show. It will be re-aired on Tuesday and Saturday, as well as on tvb.com. Until next time, from the Per Report team, good night, good luck, and good health.